Devin was diagnosed with ALL, acute lymphocytic leukemia. It was December 31st, 2010. Devin was 3 years old when he was first diagnosed.
When Devin didn't have a lot of energy, lethargic, had a fever, persistent, that wouldn't go away. So we took him to his pediatrician and she drew some blood and called us back saying you need to go to Dayton Children's because she didn't like the results of the blood test, but didn't give us really any more information than that. So
when we got to Dayton Children's, we met with the hematologist. They ran their own set of labs, and then that's when they came back and said that Devin was positive for leukemia.
I guess, that diagnosis is always difficult, but Braden, our other son, was just treated for open heart surgery 6 months earlier. So it was difficult to hear that news.
Well, needless to say, when he was diagnosed in the hospital on New Year's Eve, we didn't leave. He was admitted right away. He was given a platelet and blood transfusion. He had a bone marrow aspiration the next day, which was Saturday, and Sunday was scheduled for surgery to have his port implanted and had his first round of chemotherapy. He was in and out of the hospital a number of times, scheduled routine chemotherapies. The non-scheduled, it just depended on what was going on, if it was a fever or other complications, which he did have. These are called Emily's beads of courage. Anything that he had been through during his treatment, he received a bead for, and so now he has 5 necklaces to show his journey.
With like 1,000 beads on here.
Almost 1,000
beads,
yeah.
Well, I was kind of scared, and I really didn't know what was happening with Devin, and so I kind of was trying to get through it, but also try to help him get through it. We go in the swings we just talk sometimes about our feelings.
Basically, we like to do a lot, basketball and baseball.
I personally really didn't know much about the Leukemia and Lymphoma Society. It provided a little bit of financial help, but it also provided us all the information that we needed to know more about leukemia.
Well, thank you for helping me.
I was 14 years old when I was diagnosed with AML leukemia, which is acute myelogenous leukemia, and I'm now 18 years old. The emergency room doctor, he came in and he said, yeah, I don't know how to tell you this, but you have cancer. I was 14, so I was like, my hair, oh, my hair. I wasn't like, cancer, I'm gonna die.
We didn't know what leukemia was. I thought of cancer, something as a tumor and you take it out and it's gone. We were in the restroom and she goes, I don't think I can do this. Mama, I don't think I can do this. She was just so tired and so sick at the very beginning. And I said, you have to, Katie, there's no other option here.
There's 5 rounds because I wasn't selected for a transplant. So I got 5 rounds of chemotherapy.
She got the last round of chemo, and it didn't take 2 days after your chemo before she was in septic shock. She wasn't getting enough oxygen, so we had to intubate her. And at the same time, it was within just maybe 24 hours, her kidneys shut down. She had at least 2 occurrences where her blood pressure crashed, and they had to come in with their different medicines that they were pumping in her, and literally yelling, Katie, don't give up. And that's when they came in and said, we don't see how she's going to recover. It was hard. We had 8 weeks that I didn't hear her talk to me. I didn't think she would give up.
I want to be a nurse in the future. I want to work in pediatric oncology. I'd like to work in a children's hospital, just so kids have an example. I didn't know anyone who had cancer, so I want to be there for them so they know, somebody survived this. I can do this. I kicked this thing's butt. She did it. She's my nurse. I can do it.